about venous complications.
Well, I appreciate the invitation to discuss venous complications with you, and I'm going to try to fly through a bunch of cases fairly quickly here to show you a myriad of different complications, predominantly related to the deep venous system, and due to the interest of time, we'll probably stick to IVC filters and stents. IVC filters themselves are becoming more and more easier to put in and easier to take out for the majority of cases. And these qualities have resulted in a real increase in their growth in terms of procedures over the last few years. And with this increased number of procedures being performed, we're seeing more and more IVC complications. These complications can consist of anything from migration either of the entire filter or pieces of the filter, IVC thrombosis, perforation of the filter, and despite the filter being in place, recurrent PE and even death. And we'll try to touch on and show examples of almost each one of these different complications. This image was provided courtesy of Dr. Williams from Ann Arbor. This was actually embolization of an entire filter into the left pulmonary artery. And Dr. Williams actually went in and snared the device, successfully removing it through the heart. But because it was uncovered, he actually tore up the tricuspid valve significantly to where the patient ended up going to surgery anyway. So the lesson from this case is don't pull unsheathed filter through the heart. This case here is an example of, an example of a patient who showed up with, let's see if this video plays. Maybe not. An example of a patient who presented with chest pain and underwent coronary angiography, and actually the cardiac catheterization was, it's playing on your screen and not mine. While we were doing the LV angiogram and the cath, we noticed all these small linear metallic pieces in and around the heart and in the lung. And did some more investigating, and there was a filter down in the abdomen with parts of its support structure and anchor legs missing. And so that was migration of filter pieces. And in that particular case, we just left the pieces in place, but the filter was subsequently removed surgically. Here's a case of a young woman who presented with abdominal pain after an IVC filter was placed several years later. And you can see here the bits of the filter coming into frame, but significant amount of gut edema and inflammation around the bowel where this filter had actually, the struts and support arms have went through the IVC and irritated and inflamed the adjacent